That's the first step, is recognizing that you have a problem. So the difference between monitoring 1.0 and 2.0 is basically the analytics, the actions, the actionable information, and acting on that information to change the future.
Welcome to Future Perfect Tech, a webinar and podcast series by Harbor Research. Each month, we'll be having discussions with the leading experts in smart systems and the Internet of Things on innovations in markets, technologies, and ecosystems that are working together to build a better future.
I do believe in
a strange way, I'm
soul,
optimistic because I'm sure
do
we're going
we
to run
have
into
the
more
models,
big
the
societal
frameworks,
roadblocks.
the
When will we see
technology,
mass adoption
enable
of
data
edge
sharing,
technology
and is
and
there a way
AI?
to monetize that? Welcome to Future Perfect Tech, a series of discussions from Harbor Research with leaders in smart systems. Today, we're looking at cold chain storage, a technology in a market that, with the distribution of COVID vaccines, has been in the news every day for the last few months. So what exactly is cold chain storage? Why does it matter? And what role do smart systems play in the world of biopharmaceutical research and distribution? We'll be speaking today with CEO Kriss and COO Wilkes of KLATU Networks, a technology company that provides 9 of the 10 largest life science companies with a solution to predict equipment and freezer failure. Rick is an industry veteran with 25 years experience in wireless sensor networks and application frameworks. For the last decade, he's focused exclusively on designing and building cold chain applications in the life sciences industry. Kriss has spent the last 2 decades leading teams that are developing and deploying medical device and biotechnology products. He also founded 2 startups, both of which are now part of Thermo Fisher Scientific. From Harbor Research, we're joined today by our president and founder, Glenn Almendinger. For the last 3 decades, Glenn has been one of the most sought-after experts in smart systems, guiding industry leaders to discover, design, and develop new growth opportunities. I'm Owen Jennings, and I have the privilege today of moderating what I know will be a fascinating discussion. So let's get started. So Rick, what is cold chain as a concept? What is cold chain storage? Why should we care? And what's at stake here?
Cold chain storage is different than cold chain. The two are related from the customer's perspective, but they're very different from the perspective of a solutions provider like KLATU. So our business is about the freezers, the refrigerators, the water baths, any temperature controlled device involved in the manufacture or storage of the product. Some of them are, we sometimes call it controlled temperature because some of the products we monitor are room temperature. A lot of people don't know that that is included in the cold storage domain. Then you have the 2 to 8s, and you have the ultra lows at -86, and then you have the liquid nitrogen down at -196, and all of that's in our domain. In a parallel universe, there is the transportation piece, which is, companies like Cryoport, FedEx, UPS, DHL are in that business, where something comes out of the cold storage unit, okay, and it could be in a picking operation where they're removing something from the freezer, they put it on a cart, the box has dry ice in it, it goes down a conveyor belt, it's sealed up, and goes onto a FedEx truck. That package eventually gets onto an airplane, Chicago, Charles de Gaulle, Mumbai for a clinical trial, and then goes into a freezer at the end of the shipment. So we have the storage in the beginning, we have the transportation in the middle, then we have the storage again at the end. And today that can be 3 different vendors. So the significance of the question is not just what is it, but what are the implications when you have 3 vendors involved in one transaction? From the customer's perspective, it's one transaction. Unfortunately, the way the market is segmented today, it's 3 vendors. So if something goes wrong, is it a shipping problem or is it a storage problem? And that's where the distinction between shipping and storage becomes very important. But cold chain can exist like in the food industry, for example, where you're manufacturing something that is an unstable, has unstable components that can go stale, which would be a customer experience problem, or it can become harmful. So in the food industry, which is a very, very large industry, there's a notion of the importance of food safety the requirement is a clipboard. So if you go into a restaurant, for example, or a deli, the requirement, the federal requirement, which is administered usually by the county, is to keep track of the temperature with a clipboard. Some health inspector shows up and says, "Show me your clipboard." Take that exact same application and let's go into the pharmaceutical industry. It's still a cold chain application, but there's really no clipboards. That's not the way it works. That's insufficient. In our industry, there's a requirement for a system of management, a system of record, and proof of the integrity of the data. So under the federal rules that we call CFR 21 Part 11, we have to prove that nobody can change the data. We have to prove that the data went from the device into the database and had no opportunity for change, corruption, or additions or eliminations. Once it's there, we have to prove that nobody can access the data and that is not authorized. And if they access the data, we have to record the date, the time, and who did that. Okay. So in our industry, the regulation is extremely strict and precise, covered by federal law, down to the data element. In the food industry, a parallel universe, what we call commercial refrigeration, there are requirements, but they're not nearly as complex in terms of substance or in terms of documentation.
So Rick, tell me about what the cold chain means in the context of biopharmaceuticals and life sciences. What's at stake here? Why should we care about this?
Because for drugs that have a temperature storage specification, whether it's room ambient, 2 to 20 or -80 or -196, if you don't keep the drug at that prescribed temperature, which is the temperature at which FDA approved the drug, the implication is that the drug loses potency or efficacy. Okay. So now that vaccine gets into the market, it's been improperly transported or stored, who knows where. Could have been at the origin freezer, could have been on the airplane, could have been at the freezer at the destination. That drug's potency is now not what it was when it was manufactured. It's administered with the expectation that it's 100% effective, and it's not. So there's a CDC study out there. I think it's probably about 5 years old now. CDC's been worried about this for a long time. And the study, as I recall, estimated that between 15 and 35% of vaccines had a potency problem or an efficacy problem. The difference between the two is one might work and the other doesn't work. When the efficacy is 0 because the vaccine that was supposed to be stored at -80 or at 2 to 8 sat on a tarmac at an airport in Florida for 2 days. The dry ice sublimated, meaning that there is no more dry ice. It now goes to room temperature. The vaccines are damaged. It gets to its destination. That whole box is useless, but there is no mechanism to determine what happened to that product unless there was some kind of a data logger in it, which is required on the regulated side, but not required if it's a product for a clinical trial. So all of this is much of it is a best efforts kind of a thing, and there's not enough precision in the industry to always catch that a problem has occurred. And that's a maybe. With certainty, there's not any technology in the market to tell you where it occurred. So if you have a potency problem at the destination, there's really no easy way to determine whether it was at the origin of the shipment, the transportation that occurred to move it, or at the end of the shipment. It just doesn't exist. That's a chain of custody problem, which is probably 2 years ago, that term didn't exist.
Yeah. So Kriss, what can go wrong in the biopharmaceutical and life sciences cold chain?
So, wow, every scientist that I know, when you talk about a freezer failure where they lost samples, they nod knowingly. I remember the first time, right, when I was in the lab and we lost a ULT freezer. there were students, grad students, postdocs who had lost 5 years of research. So there's an incredible waste that happens in, I'll say, the scientific cold chain, as we're including storage in that term. So we've talked a lot about therapeutics and vaccines, but there's also just this enormous waste that happens in the research markets and other markets in biopharmaceuticals. So I think for me, right, the big thing is our systems can help customers avoid that waste, and it's significant. I mean, again, every scientist I know, I don't have the number, but every scientist I know has experienced a freezer failure. They've lost samples, they've lost time and money. Our system is often, Rick spoke previously about CFR 21 Part 11, and our efforts to be the system of record. Oftentimes, customers are installing our system over the top of their system of record, and that's because it helps them understand their fleet's health and get ahead of issues rather than dealing with a freezer failure at 2 a.m. They can on Sunday morning, they can schedule service on Monday afternoon.
And then with particular reference, this very timely issue of vaccine distribution, what else why is this so important? I mean, I've heard about the issues of potency, of efficacy. What are your systems, your customers, your partners, what are you ultimately aiming to prevent?
Catastrophes. So
Yeah.
a catastrophe occurs when the product is not saleable because of a production problem, not usable at the point of use, 1,000 or 2,000 miles away. And that's what the whole system is designed to, our system is designed to do, which is, we call it predict and prevent, which is knowing ahead of time that something is going to happen. Now, in our business, that's the prediction of a freezer failing. But on the cold chain side, where we also have some expertise, we've developed a lot of software on the logistics side, it's predicting. So when a box goes through the system of an overnight carrier, it's weighed every time it reaches a distribution center, when there's a transfer from one airplane to another. If you know what the weight of the box is at the origin, and you know how much dry ice or liquid nitrogen went into it, because when you weigh it, when you do that, that's how they decide how much liquid nitrogen and dry ice to put into it. And if FedEx or UPS or DHL give you a weight a day later, you can measure sublimation, and you can decide that shipment does not have enough thermal energy remaining to get to Sao Paulo, Brazil. So there's predictions that you can make all over the place in our industry that have tremendous importance to the customer. If you tell the customer, you've got a product shipping, sitting on the tarmac at Miami International Airport, and right now, today, it's okay, but by our calculations, when it reaches its destination in 27 hours, it's not going to be okay. They'll go out and intervene. There's actually companies that you can hire to go out and pick that box up off the tarmac, put more dry ice into it so that it can continue its journey. That's huge. That's a prediction.
Right. And maybe if we had, to make that even clearer, some good examples of some application use cases or solutions in the marketplace.
Well, on our side, the application is on the research side as well as the production side, the monitoring of the freezer. So that would be in our business, it's a differentiating feature, which is the predictive failure analytics of the freezer. So the customer buys our system, often in replacement of an existing system, an existing temperature monitoring system, and we're doing the predictive part. We're trying to transition the customer from a fail and fix maintenance model to a condition-based, proactive maintenance practice where they get ahead of the problem. So the use case for us is the storage on the property or the storage of materials at a biorepository. We have other applications for monitoring incubators. There's actually more incubators in the market than there are freezers, almost 2 to 1. And so there's a different use case there. That's cell growth, and that's very important in the vaccine business. And then we have walk-in rooms. So these are rooms where there's so much material of a particular product that they're on pallets as opposed to into boxes. So those walk-in rooms are very expensive, dual stage installations, and we would be monitoring two independent compressor systems, and we call them A/B. So A runs for a while, B runs for a while, and if A fails, B knows about it and runs continuously. So different products, different temperatures, different purposes. Incubation is very different than storage, but again, to the customer, to a facilities manager, or to to laboratory operations, it's kind of all the same equipment. They're all mission critical equipment. And maybe that's a good time to let Kriss talk about that a little bit more.
I think the way I look at the cold stream, right, or the cold chain is we do a pretty good job statically. I think the challenge is having one system that can trace basically chain of custody of a sample from its initial production all the way into its initial storage and then shipments. With the Pfizer vaccine for COVID, it's one of the first times that -80 has been part of the, I'll say, broader healthcare cold chain issue. And that is an area that KLATU has a lot of experience and expertise in.
Rick, isn't this all, I mean, in other words, if I have storage at each end and I've got multiple transportation personas, this is like so many other IoT-like use cases where data networks are supposed to solve the problem that all these different multi-party systems create, and just trying to integrate, like in this case, track, trace, genealogy, and the ability to understand, the state of things, on an end-to-end basis. Isn't this all really converging?
Yeah, it is, Glenn, and you and I have talked about this before, because we both go back to the 80s, where we had the religious wars of protocols in the IT industry.
Yes.
We had DECnet, WANGnet, AppleTalk, SNA, SDLC, 2780, 3270. The other people on this call probably don't remember that, but you and I do.
Yes, we
That's going to repeat itself in this industry, I believe, as the customers assert their needs for application consolidation, because they're going nuts with this application fragmentation problem where everybody's popping up with a cloud app. Okay, some manufacturers see their survival dependent on a shiny object called the cloud application. And so we have people with expertise with sheet metal and compressors developing software. Some of them might be able to pull it off. Most of them won't, okay? Because it's a very complex cross-industry technology here. We have the convergence of database, wireless sensor networks, analytics, and I think the most important piece, the piece that is really making our business go, is the integration, where we're integrating with building management systems, OSI, SoftPi, and some proprietary systems that the customers, these large pharmaceutical companies, have developed custom applications of their own that in some cases been around for 10 or 20 years. They don't want to throw that out.
Right.
So there's a convergence, and that's the proper term, by the way. There's a convergence element to the industry in transition, but there's also a need to recognize how the customer is thinking about this. And the first thing they don't want to do is throw out applications that they've had for a long time. Okay, they want to integrate, and that integration is the means by which the old way and the new way meet in peace, so to speak. Okay,
right.
without the customer having to go through a painful transition in software and operations. Customers don't like to do that. They like to take incremental changes towards an objective.
Isn't this what you described in some of our past conversations as monitoring 1.0 versus monitoring 2.0?
The way that I kind of look at it is monitoring 1.0 is a simple observe and report system.
Right.
And if you've ever seen the movie Mall Cop, right, that's their job, right? They observe and report. The track system, the KLATU's track system goes beyond. It's more, if you're a movie buff, it's more like the Minority Report, right? So we're getting in the minds of the equipment. We're getting ahead of the issues. And, my favorite example is a ULT freezer running at -80. You can walk by it and see it running at -80. You can, in your monitoring system, you can see it holding steady at -80. But the truth is that that unit might be sick. It might be behaving in a way that indicates a future failure. Our system picks that up. And, I think some of our customers have standard operating procedures where once a month they look at their monitoring system and they go through and they try to see if the unit is not behaving correctly, right, with their eye. The great thing about our software is it's doing that every night, and it's doing that automatically for you. So, every morning you get up, you get a report in that tells you if you have any units that are under undue stress, and it incites you to do something about that. The other piece is, when you have a large fleet of equipment, oftentimes it's running inefficiently and you don't really know it, right? So, the simple task like, defrosting the freezer or changing the gaskets or making sure the gaskets are sealed will show up in the track system. It'll be apparent to you that there's a problem that needs to be addressed.
There's differences occurring in the monitoring industry. So you got hundreds of companies out there that can do monitoring, including, established companies like Siemens and Johnson Controls and Honeywell. And we see the market bifurcating itself into the industrial controls market that you and I have been in and around for a long time. That market's going to be around for a long time, building controls and process manufacturing and things like that. But the Internet of Things is when you have devices like this, that run off of a battery for 2 years and have 7 sensors on them. We call them an EKG kind of a device that can attach to a freezer, an incubator, a microscope, or a mass spectrometer, and do wonderful things for it. That's a different business. That's a different business, and that's monitoring 2.0 for us, is taking the data, which we get more of. Monitoring 1.0 is usually just temperature. We have 7 sensors on this device, the door, the amperage, the voltage, the room ambient temperature, the humidity, and the status, the health of the device itself, because half of the failures in the market are due to networking and device failure, having nothing to do with the failure of the freezer. Just ask Harvard Medical in about 5 years ago. They lost 1/3 of the world's autism research, and that was a network failure. Okay, not a freezer failure. It was a network failure that failed to process the alarm. So that data is now in the monitoring 2.0 world is an element of a recipe. Okay, it's like the flour in a cake. We take that information and we convert the data to knowledge and wisdom. That's the actionable component of taking the data, processing it. In monitoring 2.0 for tracks, we're comparing the performance of that freezer to the performance of its peers in the population, much like a FICO score. We have patents on this. That FICO scoring concept can make sense of the data because we're able to say this freezer is performing in the lower quartile of its peers on the measurement of energy and mechanical stress. Okay. And if it's performing in the lower quartile, you shouldn't wait for it to break. That's enough information for you to go take a look at it to figure out what's going on. Just like going into a doctor's office and having a temperature of 102. That's the first step, is recognizing that you have a problem. So the difference between monitoring 1.0 and 2.0 is basically the analytics, the actions, the actionable information, and acting on that information to change the future, to avoid a catastrophe, to reduce energy costs, increase the service life of the freezer. It's one or all of those things, and that's really what monitoring 2.0 is to us.
That's great. In many respects, you are that move from monitoring 1.0 to what 2.0 was largely just the acceleration of the innovation and technology in these kinds of systems.
Well,
I guess
it,
in many respects, one of the catalysts I see obviously driving, the whole cold chain story is COVID and the whole distribution of vaccine system. Have you seen anything like this before at this scale?
no, the only vaccine that I'm aware of that has to be maintained at -80, other than the Pfizer COVID, is the Ebola vaccine.
Ah,
So, and really, I think we're going to see a transformation in colder and colder drug products or vaccines being shipped, only because the science gets closer to or I'll say the clinic gets closer to the bench if we're able to ship and maintain colder and colder therapeutics or vaccines. Pfizer, the reason their vaccine has to be stored at -80 is because they didn't take the time to go through all the stability testing, which takes a long time, and their development was at colder temperatures than, let's say, the Moderna vaccine. So, I think there's reasons to ship colder and colder therapeutics.
Let me add or suggest that there's two phenomena that is occurring in the market. The first is that when we started KLATU in 2012, that's when we have officially doubled down on this predictive thing. There were six of the top 10 blockbuster drugs were therapeutics requiring cold storage.
Yeah.
We're now up to 8. 8 of the top 10 blockbuster drugs require cold storage. So there's that theme moving through the market, and that's a big boulder. Okay, there's a structural change occurring in the pharmaceutical industry at the molecular level.
right.
That's driving demand for cold storage and cold chain logistics. And then you have these episodic events called Ebola or COVID that are spiking activities on top of the trend. Does that make sense?
Yeah, it makes perfect sense.
So we're right in the middle. We saw some slowdown last year as the organization struggled with work from home practices. Okay, but that was coincident with the event itself, on the net being positive for everybody in the industry. Okay, but we're right in the middle of that COVID phenomenon now. There's no question that it's making changes across the industry and certainly in our business too.
So if if I have an industry full of multi-party systems, and I have vaccines driving innovation and at least some degree of orchestration of all the data and knowledge elements that drive these cold chains. How do you see this relating to the rest of the IoT space? I mean, in other words, the things that you're doing from a fundamental innovation standpoint, the move or the shift to predictive systems, that's a hugely valuable shift that I can think of many other adjacent markets where it's even more crazy, and there's less compelling reasons than vaccines to try and drive sanity into how that gets organized. So I got to assume that cold chain is a catalyst for other IoT innovations and applications and other adjacencies.
I'm not smart enough to figure out how all of this stuff is going to play out in the ubiquitous universe of IoT. What I do know is how to take the IoT technology that exists, optimize it for a purpose, and execute on the optimization, the customization, those pieces which are necessary to do one thing or two things, and that would be cold storage and cold chain.
Well, but this would be about the KLATU's, core strengths are your understanding of this domain, your ability to innovate, but systemically, not just a piece. In other words, it's not just my predictive software. I've organized my ability to really optimize the performance of the whole system from comms all the way
That's
through
correct.
predictive apps and analytics in a manner that allows the realization of that value. That's great.
Yeah, so our competencies, maybe the simple answer, sorry for the long answer, but the simple answer is, we're in cold storage. We know a lot about cold chain shipping. Those two are going to converge, but we have orchestrated and optimized the factors of success. That's what we call them. Some of those factors are technical, some of them are tactical, some of them are strategic, but we've organized them in a very special way, and we baked it. And what comes out of the oven is called monitoring 2.0, and it includes all of the aforementioned things.
Kriss, all of this new technology and innovation that's being driven in the cold chain must be very challenging for a lot of the OEMs. And just because of your history, maybe you could comment or just give a little perspective on how OEMs maybe should be thinking about all of this.
Yeah, well, from my experience working within very large companies and small companies, I think everybody realizes that digital transformation is coming. Everybody is grappling with it in different ways. And, when I became aware of KLATU, I think in late 2014, it occurred to me that, it was a company that was doing something with IoT, right? There was an actual reason to be doing it. And so, for me, right, even within a very large organization, we were struggling with our digital transformation strategy, right? And we have the resources to throw at it, but not really the expertise. And so, in my experience, even large companies, manufacturers of equipment and things like that, really don't have the expertise, or I think it's really a time issue. They now don't really have the time to start and launch a digital transformation strategy without the help of outside partners. And that's one thing that KLATU is really focused on doing, is seeking out partners who are interested in a digital transformation strategy, and we can help enable that.
But alignment, just getting alignment between what drives the OEM and the equipment story with just how end customers want to manage all of this capability, it's got to be a contentious space.
It's interesting because if anybody talks to a customer and they ask them, how many cloud instances do you want to manage for your equipment fleet or your laboratory, they're going to say one. Right. They don't want 6 clouds. They might deal with 1 or 2 or 3, depending on the nature of why they might sign up for those different services. But I think the real challenge is, for all the things that could be monitored and looked at or otherwise digitally transformed in the laboratory, the challenge is all the systems that have to be maintained, and all the logins and ecosystems that people have to live within. And so my opinion is customers are looking for some consolidation of those clouds, of that digital transformation. They're looking for the manufacturers to really come together and work together to provide an ecosystem that the end users can get value out of.
So I think that's maybe the key word is, okay, you don't have, except for 1 or 2 companies that can operate worldwide, what is still present in the market is an orchestration requirement.
Yeah.
Mm-hmm. And there's companies that have project management, they have a technology, they have project management, they bring all of these disciplines together with the products, and they orchestrate the factors of success that are necessary for the customer to succeed. Unfortunately, that's the way it is right now. There's still on the service side, it's still a siloed industry.
Sure. And I think that's true in a huge number of these kinds of IoT worlds. Isn't orchestration of data and services and all of these elements and all these moving parts in these cold chains a huge opportunity for you in the future?
So it's an interesting position that KLATU is in, because on one hand, and a conversation I might have with the customer in the morning could be on cold storage or the bridge into cold chain, okay? But in the afternoon, I could be talking to a customer about integration. So for example, the customer's problem is they have multiple vendors. There's at least 10 freezer manufacturers that sell products in the United States, and all 10 of them have some form of monitoring system. And the customer doesn't want that. They want one monitoring system that presents the information, hopefully in a monitoring 2.0 context, in a homogeneous user interface that is agnostic as to brand. All of the equipment is functionally freezers, and the brands is the subtext that doesn't matter when it comes to management of those assets. So a good example would be Quicken. Quicken, I looked at them years ago because it's an interesting business model. Has integrated with 5,500 banks. And I remember when my bank, Wells Fargo, at one time had a banking application. I can see everything. I can write checks. I can see the brokerage accounts, and had a lot of services to analyze my balances and things like that. And now banks don't have those applications because Quicken took that away from them and delivered to me what I wanted, which is I had Wells Fargo, I had KeyBank, I had Schwab, I had Bank of Hawaii. They did me the favor of pulling all of those disparate data sources into one one system. And I'm sure it was a lot of work for them as an integrator. All I cared about it was there's no work for me to use it. Okay. And I think at the core, we're going to have to integrate all these disparate assets with all these different brands that have all of these different interfaces and give to the customer what they want: open systems architecture and ubiquitous connections.
There's an opportunity for OEMs to jump on our digital transformation bandwagon. And we're open and welcoming for that, and we'll put together good deals for the customer and for the OEM. So I think the opportunity is here. We have several have taken advantage of it, and we need more.
Yeah, and I think where Harbor comes in, Glenn, because I've tracked you guys for decades, is I think Harbor is calling attention to the contentions and the barriers and the seams and the points of friction in the market that are perceived to be threatening to the OEM, who in many cases has this go it alone strategy. That they understand the market, and I think that's really risky because the market is very complex. You get into these integration strategies and these protocols, and just the notion that if you're going to get into the connectivity business, there's no margin in the connectivity business. There's only hell when the stuff doesn't work. Okay. That's not something an equipment manufacturer should want to get involved with, because that game costs millions of dollars to play. But the good news is that's not what differentiates them or us. So I think where you guys come in is there's a few number of companies that can implement the strategic secret sauce that an OEM might have and wish to control. And that's really where I think the OEMs need help, quite honestly.
So Rick, this begs the question, why now? What's so optimal about the current situation we have right now?
Well, in our industry, COVID really changed the game, because it in the industry, cold storage problems are well understood. Kriss spoke about his experience as a bench scientist. Every bench scientist has lost research. But what's happened with COVID, it kind of happened a little bit with Ebola, but it really happened with COVID, which is this awareness it was in the LA Times, on CBS News. We had an event just last weekend here in Seattle, where I think 800 doses, a freezer failed. They had like 3 hours to do something with the vaccines. They went on television and radio and said free COVID vaccine. A line formed out 2 miles long within like 15 minutes. Okay. That level of awareness has never been seen before in our industry. And there's people that, from, college students all the way up to, programmers working for Amazon here in Seattle that now know about cold storage. So that, I think, is the tide that has come in to float all of the boats.
So guys, you've at KLATU, you've now, I would say you're beyond the tipping point. You're in a very enviable position in the marketplace. 9 out of 10 of the largest pharmaceutical companies are customers. You have most relationships with just about all of the important OEMs in this space. You're obviously in this fantastic position. What advice can you give to other verticals, other innovators in their spaces, to the question that they're going to be facing, which is why now? When do I recognize in my market, when is the right time to invest?
It's taken us 8 years to get it right. So my first advice to anybody listening to this podcast who may be in the IoT business is the technology piece is table stakes. You have to have something that works, that provides a useful result. You better be thinking about monitoring 2.0, because if you're not, you're going to be aiming behind the market. But that's not the hard part. I think what we've learned in the last 8 years is the tremendous amount of effort and risk and capital required to get 3 of the top 10 customers initially to anchor the business. And that's been the hard part that has taken us a long time to get the customer base, to have the success stories. And for companies wanting to get into the IoT business or even get into our space or even compete with us, the technology is not the hard part. It's hard. But if I had to, it's like an iceberg, it may be that's a third of what appears to be important that sits above the waterline, but there's a big chunk of ice that's under the waterline that is time, experience. I can't tell you how many millions of dollars we wasted trying to figure out how to get Wi-Fi to work, trying to figure out how to get our predictive models to work, understanding how to talk to the OEMs, how to talk to the customer, just realizing that integrating with Pi or a building management system was important. You don't learn those things until you're in the industry, in the trench, for 2, 3, 4, 5 years. And that would be the advice or the piece that I would share that distinguishes KLATU from a lot of other companies who've come in recently. Because we don't run this company with VC, we can't afford to make many mistakes, nor can we afford to not be successful with the customer, because the customer is generating the revenue and the cash to run the business tomorrow. Okay? And so experience matters. And by the way, you should really appreciate that 747 metaphor, because that's one of the better ones that I have.
Yeah, good one. Well, Kriss, Rick, I would very much like to thank you for participating with us and sharing your perspective and helping us understand the innovations that are going on in the biopharma cold chain.
Well, Glenn, I'll tell you, you and I have known each other for a long time, and I read every one of your reports and your news items, and I think of the research companies that I know, I think you guys are way out in front of the market. I think you really do understand the value chain and some great stuff. And I'm hopeful that the OEMs that are out there that are standing on the sides of this phenomena called digital transformation can find you quickly, because I think you can offer them a lot of help. And I think you're doing great for the industry. So I appreciate that, and happy to participate in this podcast with you. Thank you for having us.
Thank you.
Rick, Kriss, and Glenn, thanks so much for your time today. And to our listeners, we hope you'll tune in next month when we talk to Guneet Bedi, Senior Vice President and General Manager of the Americas at Relayer, about the business and service models that drive success in the industrial Internet of Things.
Harbor Research is a growth strategy consulting and venture development firm with over 30 years of experience working with leading manufacturers, service providers, and technology developers to discover, design, and develop smart systems and Internet of Things growth opportunities. Visit harborresearch.com to learn more, or follow us wherever you get your podcasts.